Everyone, and welcome to this very special presentation of the Global P.A.D. Awards. We are presenting the Global Patient Champion Award of the Year for 2025. Today, we honor Dr. David Armstrong, a true warrior for those affected by peripheral artery disease, or P.A.D., which is poor circulation in mainly the legs. It's a disease that is more prevalent and deadlier than most cancers combined. So it's a really critical disease. And Dr. Armstrong has an unwavering commitment, and that has changed the lives of so many patients across the globe. He has championed patients, preserved limbs, and truly not only saved lives, but truly changed lives worldwide. Nominated by both patients, he's indirectly helped and countless individuals who have witnessed his tireless advocacy online. Dr. Armstrong has truly dedicated his career to advancing PAD care, even at personal and professional expense, although he wouldn't see it that way. His global travels to spread awareness and share advanced treatment options have truly bridged critical gaps in care across continents. And as distinguished professor of surgery at USC, director of the Southwestern Academic Limb Salvage Alliance, and founding president of the American Limb Preservation Society, he has fostered collaborative networks between practices and implemented shared decision-making approaches that have improved outcomes for patients across the globe. Through connecting specialists across borders, he has created I believe, is a unified approach to PAD care that has directly prevented countless amputations and I think has given a voice to patients often unheard in our healthcare system. Now, in terms of those, he has indirectly helped through the Leg Saver Hotline for the Global PAD Association. I have to share one story that really just stands out before we bring in Dr. David Armstrong. When a patient faced an unnecessary toe amputation scheduled for a Saturday night about midnight or 1 o'clock in the morning with no life threatening circumstances and no vascular evaluation beforehand, the patient contacted the Global PAD Association seeking a second opinion. And Dr. Armstrong immediately guided us to USC's limb salvage team, where it was determined that only a minor debridement was needed. And today, that patient walks without any problems at all. So, just a testament to the true heroic efforts of Dr. David Armstrong, and we want to congratulate him. But first, I want to bring in my co host for this interview. It is the 2024 Global PAD Champion of the Year, Dr. David Alper, who serves on the AHA's P.A.D Collaborative, the Board of Trustees for the APMA, the ADA's P.A.D Alliance, and of course, he's on the Board of Directors for our organization as well. So please join us in welcoming Dr. David Alper and in congratulating and welcoming Dr. David Armstrong, our Global PAD Patient Champion of 2025.
Holy cow. Thank
After
you very much,
that
Kim.
long
That is just
soliloquy, but I just have so much to say about you and to celebrate with you.
listen, that was a heck of a soliloquy. You can only be disappointed after that whole thing, but you know what? This is pretty great. And to be in the company of Dr. Alper and you, Kim, to use the term warrior is an understatement for the two of you. Dr. Alper is a road warrior as well as a patient warrior. He just got off the plane from Washington, D.C., as I understand it, following his peripatetic ways. And you, of course, 24/7 on that hotline, trying to help folks move through the world. It's well, I don't even know what to say. It's just an absolute privilege and pleasure. I'm just pre-op right now with one of my patients right across the street here, and just waiting for all that to go. Thank you very much. It's just life-affirming stuff.
How did you go from, just someone who was managing patients in the clinic, performing surgery, to a global advocate? What was that defining moment for you when you said, you know what, as much as I love treating patients right here, There's a bigger issue worldwide that I must tackle. Was there an inflection point in your career where you said, I've got to do more?
Well, look, I've been traveling, I guess you'd say, since I was a kid. My father was a podiatrist, Leo Armstrong. He passed away about 21, 22 years ago. This is the smartest guy I ever knew. First member of our family to go to college, actually, and second generation refugee from Belarus and Latvia, Minsk and Pinsk, as they say. But I remember I was so lucky because I used to travel as a kid. My little brother and I would travel with this group, no kidding, of foot doctors in California. And yeah, I know
No
this is
way.
like a long story, but it's actually pretty great. I'll be really, really
Wow.
quick. But yeah, yeah. And so uh, I saw the effect that people to people interaction had from just from then on. And Kim, I was given everything. Unlike Dr. Alper, I had no excuses. I mean, everything had been handed to me my whole life. And I'll just tell you the story that I still remember. Hadn't thought about this too much, but speaking of that, we were in, of all places, Leningrad at the time, St. Petersburg. And we were in St. Petersburg in the Hermitage Museum at the time that this is the height of the latter part of the Cold War, when détente was broken, the Korean jetliner was shot down. We didn't even know any of this had happened. 1983, I think. And and we're in this quiet museum in the middle of Leningrad. And my brother and I are looking at some masterpiece, some Van Gogh or something, and we hear uh, my dad talking to another foot doctor, famous guy named Tilden Sokolov. And Tilden says to my dad, he says, Leo, my dad's Leo. And he said, yeah, Tilden, listen, don't take this the wrong way. And we're trying to listen, but not listen and not say, don't take this the wrong way. We love those kids. They've been traveling with us all over the world, for the last 10 years. But why don't you just you and Barbara just treat yourselves and leave them at home one time, and you can go first class this next time. And so we're saying, oh no, we're not going to get out of school anymore. The jig's up.
Oh
My little brother.
no.
Yeah. And so we're like looking, trying not to look at what's my dad's going to say. There's like this pregnant pause. And he says, Tilden, that's a beautiful watch that you're wearing. Tilden's kind of surprised. What's this non sequitur talking about a watch? And he says, well, Leo, thanks for noticing. Yeah, it's Swiss. I bought it in Gstaad or something like this. And he said, yeah, that's a really probably took a lot of craftsmanship oh yeah, it's handmade. Tilden says to Leo, and so then my dad spins around, and then we're trying to take cover because we don't know. We're trying not to look, and he said, Tilden, that's my Rolex over there. Uh, and I pointing at us, and I never forgot that, and
Wow.
I always thought that um, if we ever had a chance to pay it forward, that I would, but again, it's just I was a kid, and I've always taken my little ones with us all over the world, and that's why God made freaking flyer miles. I figured, now our oldest, I think you might know, she's a third generation
Yep.
foot doctor. She's a
Yep.
chief resident now at the University of Texas Health. It used to be Health Science Center, now UT San Antonio, and her
Wow.
boss. Speaking of paying it forward, her boss is my old fellow, Lee Rogers, and her attendings are two of my old partners. So it's life affirming stuff.
Well, I think that there is even a bigger lesson there, and I love that you took that as an opportunity to pay it forward. But also, it's a lesson in the value of people versus things. And I think that that is the heart of who you are, is that you truly value each and every person.
Yeah. Well, look, I grew up in my pop's office, and again, I remember him treating the mayor of our city. and he had this great, and I was in there, like cleaning up, and I used to make insoles for my dad, but I was in the room when he was talking to, this guy who's City Hall was right across the street, so he was right across Broadway, and he was treating the mayor of our town, and I saw how they were carrying on this great conversation, talking about the the news of the day, the politics of the day, and it went all the way to philosophy, and then he left, and then he diagnosed uh, this polysyllabic thing that I can't even remember whatever it was, and then and then the mayor leaves, and my dad, I said to my dad, "Wow, how'd you do that? How did you pick that out so fast?" And my dad looks at me and he's like disappointed. He said, "Son, I am so disappointed in you." I thought, what did I do? Did I like not shake the mayor's hand or something? And he said, "Son, you totally missed it. Uh, None of that stuff matters. What matters is that folks uh, 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 don't care how much you know until they know how much you care." And I sort of almost rolled my eyes. I thought that belonged on some sort of like poster at the time. I was like a teenager, and just it was eye roll kind of thing. But boy, do I know what he means now, because I think patients, whether that's a patient in literally in the operating room or in the clinic with you, um, or whether it's a patient pinging you on WhatsApp or FaceTime, or it's a doctor or a nurse calling from Yemen, wherever. I mean, it doesn't. I literally just got one now from Yemen this morning, a patient by way of WhatsApp. It doesn't. They know when you're dialing it in, and they know when you're giving them 100%, and that matters more than anything. And people just figure that out. And I think that sort of thing comes through. And I think you see it with people like Dr. Alper, who's been a real legend in our specialty, and with you, Kim. I mean, I think you see that matters much more than your surgical acumen or your clinical acumen, although both of those are critically important. I mean, but I think ultimately they pale in comparison to the fact when the patient knows that you are going to go to the mat for her or for him.
Yeah. I mean, they almost want to know that you're going to be kept up at night if you end up having to do an amputation or you end up not being able to do what you set out to do. They want to know that it keeps you awake at night. Not that they would want it to keep you awake at night, but actually, we've had several doctors that have won awards over the past few weeks, and every single one of them is like you that would say, "It does keep me up at night. If I can't do what I set out to do, I mean, my goal is to literally make you whole again, and if I can't at least get you to a better quality of life, I'm not gonna be satisfied."
Yeah, that's it. I mean, that's well, I I think with Alper here, I think I'm preaching to the converted. But yes, I I feel that very, very much, without a doubt.
So you've traveled extensively to educate clinicians globally about limb preservation. What are the most significant barriers that you've encountered internationally that prevent patients from receiving optimal PAD care as you would do it? And how have you worked to overcome, some of them and some of that resistance that you may initially face when you walk in the door?
Yeah, I think at first and foremost, I think in the past, um, many places, if one of us was walking into a facility, we'd be the first of our species, as a podiatric surgeon or something like this. And that, thank God, is changing. I think you're starting to see this sort of idea of sort of a kind of a limb preservation sort of specialist, whatever you call her, whatever you call him. That sort of idea is changing. And in the past, I think that these teams haven't really existed. Putting people together in almost any sort of permutation uh, yields almost invariably a better result. But in the
I mean,
past,
getting people to talk.
yeah, that's it. I mean, really, because look, every country, it doesn't matter where you are, is if you could just get the right people, whatever you want to call it, skill set together, you can kind of be agnostic about the specialist, her or him, right? Whatever their specialty, but you can be kind of evangelical about the skill set, about, hey, these are the things that we need to check off the list in order to have a functioning team
Yeah.
in this area for peripheral artery disease, for the diabetic foot, for tissue repair, wound healing, taking care of infection. And there's certain things that you check off the list. And, we've written this down, we've validated these things now over many years. And so that kind of formulates a common language. But what's so cool is now you're starting to see this become like a thing. We were just last
Yeah.
week in Singapore. Members of my team right across the hall here, Ziwei Tan, one of my mentees. He's a vascular surgeon and has an NIHK award. Laura Shin, who is she's a world-class podiatric surgeon. She's right now in one of our other clinics right now, but she was there and she helped to run a
She's worked
surgery.
hard on a couple of our patients. She's
There
been
you
very
go.
successful. We hear good
There
things about
is
her.
none better. She's 10 times
Yeah.
better than me. Well, actually, 10 times better than me is not saying much, but I'd say
Yeah.
she's even better than Zila. I'll just put it that way. But those two are great. And, Miguel Manzer is also right here as well. I'm going to see him momentarily. But the point is that they were
Yeah.
both with me and other, Cy Dove and Mike Conti and others and, Matt Menard in Singapore last week. And there were two separate workshops going on, one on toe and one on flow. One was on, limb preservation surgery, different types of reconstructive procedures. And then the other was on bypass procedures and endo or access options. And so both of those were happening in advance of the what's called the ASVS, which was the Asian Society for Vascular Surgery. And we had our DEF CON meeting now that was kind of it was nestled within that whole meeting, and that's never happened before in the history of either meeting. And it was a massive success. These things were oversold, and the amount of interest from around the world, certainly around Australasia and Oceania, and it was amazing. It was just all of these places. If they don't already have a limb preservation program, they want to develop it. And it was perfect because it was in Singapore where we've had mentees of ours. I was really lucky just last year in the early 2024, I was a guest they have these distinguished professor expert guests that'll come for 2 solid weeks. And I was a guest of the Ministry of Health in Singapore, and they wanted to build out across the whole 6.1 million people in the country. They wanted to build out a limb preservation sort of working group and program, and that is happening. That's being led by folks who have spent time with us here, led by Joseph Lowe and others. But man, that is life affirming. And so you see this happening writ small and writ large. And it doesn't start with, just the top down, although that's the great place for it to get some attention. It starts from the bottom up. You say, Kim, and I know Dave Alpert knows, it's people to people, and it starts in a hallway, and God knows.
Oops, I think that he
Clinic.
froze. There we go.
Yeah.
Whoops, he froze
Uh,
for a second.
So,
I froze for a second.
You did.
Yeah. Oh, well, I'm sorry to freeze. I'll unfreeze. I don't know what I was talking about, but I was talking about my Flomigo Prime, Joe Mills and I starting, talking about people to people, literally just in a hallway together, with our patients and seeing patients together. And that kind of thing, bottom up and top down, makes a
Yeah.
really big difference.
well,
You
David, the
adapt.
reality
Oh,
is
go
one
ahead.
one of your strong legacies is not only the fact that you open doors, but you built bridges. And I'm so aware of the fact of how important this is, because you represent the best of podiatry, absolutely, but you've taken our profession and have it seen not beneath, but right shoulder to shoulder with vascular surgeons, with interventionalists, with physical therapists, with nutritionists, with every member of the team that needs to be put together to prevent this type of amputation. And the time that you spent to make sure that these bridges were built, and that not just the country, but the world recognized that it really is a team approach. This is how we save not only limbs, but, as you're well aware, lives. For every amputation we save, that's another life that's going to be saved as well. And your ability to build these bridges with the American societies and now with the international ones is really something that has just made such an impact on the podiatry profession, on the patients, and on really the view in general that didn't exist even 10 years ago. And you know this is true.
Yeah, Dave Alper, well, you coming from you, man, that to say that's life affirming, that's an understatement. Thank you. That's really kind of you. But again, as I said, I've had nothing, but I've had no excuses but to be able to do this. I've been kind of put in all these places, so I just been really, really fortunate. What's great though is because of the work of folks that have come before us, the job has been a lot easier. If I am the first of my species, as it were, not just in some podium, that's all, ultimately you can't be on the podium unless you actually stand on something, standing on, if you will, the work, but stand, in a hospital, in a medical center. I'm lucky. I was just the president of all of our faculty here just now, here at Keck. We have 2,500 and some faculty, world-class faculty, 6,100 part-time, and seeing that kind of thing happening, and ultimately it becomes kind of a meritocracy once you're there, and that is what I think people see. It doesn't matter about. I always say that your degree I tell my trainees that your degree should define you, right? It should tell you who your mentors are, and you honor your mentors and but your degree shouldn't confine you. It shouldn't confine you from going off and doing something. It doesn't matter if you are a foot doctor, a brain doctor, a nutritionist, a physical therapist. Doesn't matter if you're a patient advocate. What matters is you getting into the room and you being an advocate, and what keeps you there is your ability, and who you are, and bringing people together, and that's it. That's the big idea, and I think people feel that, and I think they ultimately see it.
And also training the next generation. The fact that you've created the Shins, the Rogers, et cetera, so that you can, as your father did with you.
Yeah. Well, look, Stephanie Wu, Steph's a dean now. I mean, we have folks that are professors all over the world, all over the country. It's pretty awesome. And in other, I have 3 or 4 other now NIH Career Development Award winners. Samantha Mintz now at Duke, Z-Way in clinic right now, wearing a tie in clinic, like he should. Like he's a vascular surgeon. And we have the first ever an NIHK award for podiatry, and Brian Schmidt at Big Blue at University of Michigan. All this stuff is pretty great. We always say you have your kids, your personal progeny, and of course I couldn't be prouder of ours. And but then you have your professional progeny, right? And to me, it's like that's that transcends how big your bank account is, how many cylinders you have in your car, or not, if it's electric, or how many cars you have, or how many team members you have. All that stuff pales in comparison to your personal progeny and professional progeny.
And it guarantees the work continues to be done and move forward. And that's the
you
other
understand.
thing. It doesn't stop when you stop or I stop.
There you are.
So as
Well
we
said.
move forward, where are the gaps that you're still looking to champion? What are the things over the next year that we can expect from you? We know that there are so many gaps, especially in some of the most vulnerable communities, smaller areas, when it comes to especially wound care and podiatry. The kind of the last along the lines to get wind of some of the more advanced tools and techniques that are available. Um, what do you think going forward so, we can improve the amputation rates across not only the country, but across the globe?
Well, Kim, you hit on it. It's putting these teams together, and with ALPS, the American Limb Preservation Society, I didn't want, God knows, I did not want to be part of another not-for-profit or any of these other things. And that thing started during the pandemic, and
Mhm.
I think you know something about it. But holy cow, that thing is really taken off. But all it is, all it aspires to be, is what you said. It's two things. It's a cross between a dating app and a marriage counselor,
I love
for
it.
right for the women and men that want to come together. Right, we call it toe and
Yeah.
flow, and people that want to create teams. That's it. This is the aspiration, and that now it's over like 1,000 people already. And if you look at the map now, like on the website, you can get on the dating app, as it were, and you can see who your Tomiga, your Flomiga are, and all these kind of places. And that is so life affirming, for patients, for
Yeah.
doctors, for nurses, and so that is the big deal. So for the future, I think, so formalizing those centers of excellence, as it were. This is already sort of happening, where you have these units. I know, Kim, you have been a fearless and relentless advocate for this, for bringing these, having these teams, having folks with specific skill sets. These things now are real now, and having whatever we want to call them, whether it's some sort of a center of excellence or these certifications of centers, this idea and training programs, fellowships for women and men that want to have super subspecialty in this area. These things, we'd like to see this grow into every kind of corner, not only of the U.S., but really around the world. But there is a lot of the U.S. To cover, and we want to have, the equivalent of trauma centers for, if you will, atraumatic, wounds and tissue loss for people with diabetic foot ulcers, for peripheral artery disease, CLTI. And this exists now, the how we define them, but now we can sort of codify that. And I think you're seeing the emergence of this specialty, as it were, because these things just take a long time. It takes a
No,
lot of
it's
chats and a lot of work. But just because it takes a long time, and that it's
yeah.
longer than any of our kind of career lifetimes, doesn't mean it's not worth it. It's not worth a life's work.
That's right.
It's
That's right.
interesting because I was going to ask you about the conversations that you have with people. There are a bunch of different philosophies that are still out there. You have those that are creating the evidence, such as yourselves, and those in the USC Limb
Yeah.
Preservation Society, and full USC. Like, you're all about literally cutting edge technologies, creating the evidence. If amputation's on the line, why not try, kind of that philosophy? And then you have this other school of thought, and they're like, well, there isn't enough evidence. Until there's enough evidence, I'm not going to treat those arteries below the knee or into the feet or put on that extra piece of fish skin or whatever there might
Yeah.
be. But it's interesting because I was going to ask you about how you could, approach those conversations and convince people. But what I see you doing in championing for patients and limb preservation is to almost inspire them by getting the people that are already there together
Yeah.
and putting it out there to say, look, this number is growing. Hey, don't miss
Yeah.
the boat. Come along.
Yeah. Yeah. Well, so Kim, I think you hit on it. I mean, I think it it does, obviously it does matter that you have women and men that have specific skills in distal reconstruction and intervention, and that are willing to push the envelope with their skills. It matters that you have folks that are willing to do the podiatric reconstructions out distally to try to keep people moving along, and to do like limb sparing procedures rather than ablative ones. It matters that you have physicians and therapists, and my next conversation actually is on lifestyle redesign with a team of occupational therapists. Yeah, and Z-Way is leading that with occupational therapists. So all of these different folks, that you can bring together to affect positive change, but you do have to continue to push it. You know, my dad used to say, never be the first and never be the last to do something. I mean, I don't know if I agree with him entirely. I mean, I think sometimes you got, if you have a good idea, you can be the first, or even you could be the last. I mean, I think sometimes you want to, if you have a good enough reason, right? You could die on that hill. But the point is that you want to have a good idea and an evidence base about why you're doing it. And if you're violating a precept, maybe you have a reason for doing that, but then report on it and push it forward to try to affect positive change. And that's how you do it. And you have different folks with different opinions on your team, because you definitely need that as well. You can't just have, you know, one cult of personality with she saying this or he saying that. You got to have, if you're so fortunate to have different folks with different experiences doing the work.
David, one of the things that I think has been so wonderful, and I'd love you to speak about, is bringing it down to the basic medical level. You're a 3-minute foot exam, your 3-minute diabetic that you've brought to PCPs and to and PAs and to NPs.
The other, by the way, the other Dave Griffin as well, doing such great work there too.
Absolutely. Third David.
Yeah.
But, you know, speak about that a little bit, because to me, the very fact that you're getting it at ground zero is one of the things that amputation prevention is all about. But you've taken the time to bring in the PCPs and the ancillary providers as well.
Yeah, that's right. There's just no question that is that's what's important. We also have a program that has been funded by our National Science Foundation called the Center to Stream Healthcare in Place, or C2, the number 2, SHIP, SHIP, C2 SHIP. And that's run by, I'm the principal investigator at USC, but you have UCLA and Bijan Najafi, you have Janet Roveda, you have colleagues at UND, at UMA, and at University of Missouri. It's an amazing group of women and men in that area. But the goal for that is to empower, is to push stuff from the hospital to the home, and to generate and foster new novel technologies, everything from, you know, spread on and spray on skin to wearable robots. And it is such a fun time to be doing the work. As Caltech as well, we have our sister unit there with Wei Gao. So it is a lot of fun doing the work, but pushing it with all these different clinicians. And again, I think all evidence would support, and I think my patients would agree, that I do most things pretty much below average. The only thing I do above average is I think I put weird ideas and weird people together slightly above average. Everything else, but that thing kind of helps. And I think that's what really matters in this area, because this is a team sport, surgically, medically, mechanically, and from a policy standpoint, Kim, and of course, Dave Alpert knows that for sure. He's living it.
And so I know you have to you're in pre-op, you have a patient in pre-op right now. And so
they can't start without me, Kim, as I said. And I told you before, if they did start, it would be better. It'd probably be better for them statistically.
You know, I was just going to say that, you know, this is how do you balance, right, your own clinic and then public awareness and doing something, you know, these global educational seminars, and we're seeing it right here play out. It's a team effort.
I am the luckiest foot doctor on the planet here. I have, I already told you about my partners here, my toe amigos, my flow amigos and flow migas. I told you about Laura. You got JD Shi, you got Tanzim TK Khan here over at Rancho, and who's running the limb preservation. I'm really lucky to have folks that are doing the good work and that are way better than I am. And I can just kind of wander around, bump into things, kind of like adult daycare, you know, and my patients kind of direct me in the right direction.
So since this is a patient-nominated award, there were some questions that were submitted. In fact, we do have one that's being submitted live right now. I didn't see exactly what it was. It sounds like it's more of a personal one, if you don't mind, taking a look there in the chat. It's from Heinz, who's watching on YouTube. A neurological question: how would you treat someone with foot neuropathy due to PAD, not diabetic? So I'm
Yeah.
guessing he talks about poor circulation.
Yeah.
And then his foot does have blood flow now due to stent procedures, but the neuropathy never went away. Sounds like it was, it got to a point where maybe the nerves are already shot before
Yeah.
blood flow is restored. But what are your
Yeah.
thoughts, and how should patients handle that?
Yeah, it's a great question. I'm sorry that that looks like Joshua is going through that right now, but after it's not uncommon to see to have even vascular or ischemic neuropathy. That'll happen from time to time. And sometimes that sticks around after a revascularization. And I would urge him. He can certainly ping me afterwards. Kim, I know you can put us together, but for sure. But there are now really wonderful partners that we have in our pain clinics that are doing work. It is a really exciting time to be working in the pain community, believe it or not, because there are tons of non-opioid therapies now, device and pharmaceutical now, that
That's right.
are now verging on being transformative. And we are regularly seeing people now that have really horrible life limiting pain, sometimes even almost quasi suicidal pain, be helped now with things like spinal cord stim, with certain topical agents, with now implantable tools, as well as some of the new orals, which have become approved as of early this year. So some of the NAV 1.7. So this is, and others. So this is an exciting time, and I think bringing all those things together with the pain specialists has been really terrific on our end. So those are folks now that we've been working with on a daily basis, and that has happened more and more, especially after some of the combined toe and flow reconstructions that we have mentioned. You'd already mentioned some of the DVAs. Many of those patients have really bad pain afterwards, and having
Yeah.
the pain management folks involved from the get-go can really be helpful. I'm sorry for that soliloquy, Joshua, but you're very welcome to ping us, and I'm happy to see if we can put you in touch with folks wherever you are in the US or around the world. I'm sure we could find a colleague that's doing the work.
It's interesting, not to deviate, but my dad went to one of your friends, Dr. Brian, is it Smith? He works at Hope Vascular. He's worked with, you know
Nico.
exactly who I'm talking about. So he had told my dad, with my dad's neuropathy, to try Metanix, a prescription strength B vitamin, and literally within 3 months, he's walking fine. It
What the
blew
heck?
my
I
mind.
mean, there you go. Crazy, huh? I mean, I think a lot of people used to think of these things as kind of, homeopathic or something. But there are data on, the homocysteine anyway, but
Yeah.
on the use of some of the nutraceuticals, but also beyond the just the specific type of agent. There's a lot of work going on in just nutritional support. These are things, as clinicians, very often would think as being really soft and not really, and kind of squishy when it comes to how you measure the outcomes. Not anymore. I mean, I
Yeah.
think now, food as medicine is a thing. And in addition to the food as medicine, some of the nutraceuticals, I think, have had some potential additive benefit, especially for some of the B vitamin supplementation. That's a great point. I'm glad to hear that.
I was blown away. It was Metanix. It was the prescription strength, but it was like, holy cow! I couldn't believe it. We were skeptical, but it worked.
Yeah.
But I know that you have to. But I just a couple more patient questions in general. But one, patients want to know, being a global patient champion, how would you empower patients, knowing what you know about what could be done and maybe
Yeah.
what should be done? How far can they expect a doctor to ultimately go to save a limb? I know it's loaded, but are there
Yeah.
critical questions that you would suggest before a patient has amputation or settles for amputation?
Yeah, look, I think, well, that is a loaded question, Kim, because I think some people. So first of all, I do think that an amputation done well as a reconstructive procedure is and it should be thought of that way. Initially
Yep.
ablative if you have a catastrophic infection or a really catastrophic ischemia on top of infection, sometimes that has to happen. But if the amputation is done, it should not be looked on as just something that's done and then you cover it up with the stitches and you leave or with a bandage. That should be looked on as a reconstructive procedure that is the next step, literally and figuratively, in her life or his life. So that's number one. But then now getting distal and further into the limb preservation bit, but I look at this all as the same thing.
Yeah.
I think that um, you know I think more patients are more empowered now because of the information that they have at their fingertips, literally, than ever before. And I think coming in with a list of questions for the doctor and the nurse and the team is fine, is great. I think that doctor who doesn't want to answer those questions, I mean, I'm sure there are doctors that probably don't. And maybe there are questions that a doctor might roll her eyes or his eyes about, but that's silly. I mean, you're the doctor. I think answering those things is part and parcel to looking after a patient, and addressing those things immediately brings you together, and you're doing something with them, right, and not to them, right. It's not just a hit and run kind of procedure. And I think coming in with those things, whether it's on ChatGPT or Perplexity or Claude or Gemini, whatever you use to generate those queries, God bless you. I think that is terrific. It's only gonna get better, not worse, I think. And I think clinicians are already getting used to that, especially those that have the fortune to be at kind of tertiary and quaternary kind of facilities. But I think that kind of thing gives you the ability to have a dialogue with your doctor and be doing something with them, uh, and not just have something being done to them. Does that make sense?
Yeah. I love that. You got to engage the patient. What I like when patients have these questions and they're going on Chat GPT or they're going on Dr. Google, that they're bringing them to someone. We
Yeah,
Mhm.
always encourage them, you've got to organize them. We help them organize them. And we tell them you've got to bring it to your doctor.
I
You
love it.
have to use this as the conversation that you're having. If you're thinking about it, you got to give them the benefit of the doubt. You got to give them all the information so they can help you make the most informed decisions.
100%. Kim, that could not have been said better.
Finally, our last question, and this one they just want to know. They just think it's fun. Is there anything that a patient has ever said to you or ever done? Dr. Alper knows this question very well, and maybe Dr. Alper
Oh,
can share
I don't know.
his sock
You're
stapling
putting him into
story.
a corner now.
Um, and this isn't to mock patients. This is literally like these things happen. We had a doctor that just shared the story last week of a patient that didn't know how to use an enema and ended up using it orally, and it sent his body into shock and AFib.
Oh
So,
my God.
it's not necessarily to mock, the patient. The doctors, they had a good laugh about it, after, but it's to help patients. Like some patients just don't know. So a story of someone who may have said something or did something that you're like still shaking your head to this day, but other patients could actually learn from.
Oh my God. Sure. There have been so many, but I'll tell you one. Well, I'll be quick. But the long story is so much better than the short one. But uh, I've had patients that have had their toes eaten off by their cocker spaniel. Initially by a cocker spaniel first, and then after that, I'm not kidding, a Pomeranian. Again, you're going to think I'm making this up. I'm not. And those were both separated by a couple few years. And you see your reaction there, Kim. So your reaction.
Wow.
So this is why I brought it up. Your reaction, were being shocked, would be the identical one to what I would have to my buddies, actually to my trainees who saw the patients, the fellows that saw the patients that were calling and saying, "You won't believe this, Dr. Armstrong, but I have a patient presenting with a missing toe." that apparently was eaten off by the dog. But you know, the reaction that you're having is different than the patient's reaction, because because it didn't hurt them.
Yeah.
We had a patient that just called because they were having pain, right, Joshua? But many of our patients don't have what one of my mentors, Paul Brand, used to call the gift of pain. And these folks will look like us and they'll dress like us, but because of the neuropathy from diabetes, often they will not act like us. So they will do things and make decisions that you wouldn't make if pain was guiding you. So that kind of thing, the patient, the first patient that had their toe eaten off by a doctor by a dog, he and his two parents, he lived with his parents. They brought their dog, the little Cocker Spaniel, Sparky. I'll use the word for the dog because I won't violate HIPAA of the guy. But the guy, but Sparky, yes, they brought him to the doggy ER before they brought him
No.
to our human ER. Yeah, and the dog ER, the vet looked at the dog,
Good
looked at
doggy
him, looked at the
parents.
yeah, and responding to his version. Well, anyway, he looked and he said, "Get yourself to a human ER," and he said, "No, take care of Sparky first." So and so they did their version of the Hippocratic Oath for the dog, pump the stomach and the toe comes out, parts of it. And they brought the toe, I'm serious, the toe into the emergency department in a little, like a mini, like one of the hefty bags. Yeah. And if anything, I am underplaying this. But so these crazy sorts of things happen. And this guy is a great guy. This patient, uh, and then there was another patient, similar sort of thing, slightly different scenario, but with a Pomeranian about 5 years later. So dogs, neuropathy, wounds, gift of pain, craziness, keeping legs on. That's what it's all about, trying to help people move through the world, whether it's with their dog, their furry friend, or their man's best friend, or and women's, or our own. So there we are.
And that's why you are the Global Patient Champion of the Year. We appreciate you, Dr. David Armstrong. You're incredible. We appreciate everything that you do and your commitment to save life and limb, not only right there at USC with your Limb Salvage Center, but across the globe. Thank you from the bottom of my heart.
Now, listen, right back at you, Kim and Dave Alpert, Dr. Alpert, to have this and to share this the year after Dr. Alpert is so life affirming, onward and upward, as we say.
Absolutely, my friend. Absolutely.
That's awesome.